a little bit about city suicide prevention policies. If, if all of you were here earlier in the day when Supervisor Ellenberg gave her welcoming talk, she mentioned something about the fact that we have city suicide prevention policies. It's one of the things she singled out. We're, as you will see, we're maybe the only area in the country that has worked on this, and I'll explain why we've done that along with my co-panelists. But first, even though we're a small group, I was curious who we have in this limited number of people. So behavioral health professionals, so we have, do we have anybody else? Okay, do we have any teachers or educators? Which other sessions going on now? Any medical professionals? Okay, I'll tell you why I asked this without going through the rest, because most of you look like you're from the behavioral health end or doing something in mental health. If you notice, none of the panelists raised their hands. You know why? Because we all have an association with government or our elected officials. So that seems a little maybe out of place in a suicide prevention conference. Why would that be? Well, it's part of, I guess, a theory that I'm promote, and that is, I think suicide prevention, though I think it's vital to have people who can do treatment, I also think it's extremely important to create awareness and have a culture change about what we're doing in terms of addressing suicide prevention. So for some of you who were at the last session, when I was PRing Sam, who's here at this session, it's because it's not just getting your degree in being a mental health professional. It's what are you going to do to enact change? How are you going to normalize this? How are you going to make sure when somebody wants to give a talk on ligatures for a conference of professionals that it gets accepted? People don't sort of stand back and say, well, we don't want to talk about that because that's a difficult issue. So that's what this talk is about, different from some of the others. So I'm going to go through a little bit about what the purpose of doing a suicide prevention policy is. I've even branded it. I've given it the CSPP acronym. And then we're going to talk a little bit about community support for getting a policy, how we did that, a little bit about getting a policy approved, and something about implementing it. Now, what I hoped for, but I don't think we got at this session, and I understand this, maybe we'd have some people from other counties here, because this is work we've done in this county, and it's not, it shouldn't be exclusive to us. So that's sort of what we're going to get at. So quickly, here's who's speaking to you, so you know who they are, but they can tell you about themselves far better than me, but I wanted to give you a quick overview so you know who will be talking. So when we get into the topic of support, State Senator Dave Cortese, I could put all these other, we could sit here and list all the things he's done before he was a state senator, and I put a couple of them up there just so you know, but I'll leave it to him if he wants to say a little more about himself when we get to his topic. In terms of policy approval, we have from City of Saratoga, past mayor and now current and still current city council member, Tina Wally. And then in terms of implementing a policy, which some cities have done, not all, we have Renee Lorenzen, who works for the city of Milpitas and was, I can say, instrumental in helping us get the policy. She was at the original meeting that got called in that city to talk about doing a policy, and then she helped shepherd it through. And now she's still overseeing people who are doing work in Milpitas, and she can explain that. So what's the justification for doing it? Why would some guy who's interested in suicide prevention say, hey, we ought to do city policies? What's the justification for that? Well, one of them is it fits with something that our illustrious leader, Mago Lynn, is involved with as a public health professional, fits with the public health social ecological model. More so when people focus on individuals in their relationships, this more it also focuses on community and society. It's the bigger picture. There's some justifications backed up by some international documents. I put the links in here, and the slides will be available. If you're not familiar with these two documents, you might want to take a look at them. They're more focused on community involvement. In this case, country involvement for some of them at a much higher level, but some get down into individual local jurisdictions. It's funny, I've probably done suicide prevention work now for about 20 years, and all the time I'm reading things where they say, oh, and we need to get local communities and local policymakers involved. It's stated, but you never see an action plan behind it. So it's supported by the National Strategies for Suicide Prevention, the 2012 version, which is our national plan implemented by the federal government. But also I put in here, it's compatible with what I think city government's mission is for my former or current city council members, which I was at one stage. We always talked about health, welfare, and safety as if it was our mantra, and it didn't always necessarily meant that we did something concrete about it, but something like this policy is that. Okay. What could a CSPP consist of? And I won't read all these to you, you'll have them, but it's any one of these things around education or safety, facility safety, or data collection, communications plans, and promoting means restriction for some of you who were just in the last breakout session, and a few of these other things. And let's see if this, it almost stopped on me. Let me peek here. Okay, why do a CSPP? Because at the local level, again, for those who are involved with government, it gives you authorization. It sort of sanctions and says, yeah, it's okay to work on suicide prevention. Maybe not something that a local government would naturally do, but at least when you have a policy, it gives you a nod and says it's okay. Recognize the need of local government it recognizes the need of local governments, administrators, and employee safety. In several of the cities I've gone into, in fact, in some where I didn't initiate it, they asked me to come in, it's because a city employee killed themselves. And they said, well, what can we do about that? I mean, people were just baffled. So part of the focus is specifically on the jurisdiction itself. Gives you a way to disseminate information. This to me is key, because local government interacts with its community, with its population. I'm sure if we asked Senator Cortese how much does he interact with the public in the area district he represents, so we asked Councilmember Wally how much does she interact with people in Saratoga, they're going to tell you a lot. I mean, at one stage, I was the mayor of the city I live in. I had 15 events to attend one week, besides all the other, official duties that I had. So this is a good, when you get a city involved in the administration and they're giving out information anyway on a whole variety of things, this is a way to get suicide prevention information out. Then I, again, mentioned community awareness and involvement. And then I use this simple approach, even for you who are professionals here. It's not us by ourselves. It should be all of us when it comes to suicide prevention. It's one of those public health issues that needs to permeate our culture. Okay, what's going on in Santa Clara County? Why are we doing all this? So over this period of time, Supervisor Ellenberg mentioned this, we got all 15 cities to adopt a policy. And we might be the only region in the country that's done that. I'm pretty sure we are. When I first started doing this work, I asked different professionals I knew nationally, whatever. I had to write the first policy. There wasn't any. So we're sort of in the forefront some of the people attended the last session I was in. I said we were in the forefront of that. We seem to be in the forefront of a lot of things. But any case. So additionally, some city governments have active community suicide prevention programs, and that's why Renee's here. Some cities chose to do something. When Milpitas approved their policy at the board meeting that they had, their council members said, we don't want just a policy. We know we've got some money out there. City manager, go earmark some. We want an actual program. Okay, what is next? And I say, we want to keep city administrators updated on breaking events around suicide prevention information and new programs. See if more local government officials will implement CSPP. There's nothing unique about Santa Clara County or our cities. We ought to have other cities doing this. I won't mention who, but I talked with a city outside of the Bay Area, and I did that because they came out on a national study as a city that has one of the highest suicide rates in the whole country, and yet it's a tug of war to get them to say they should be part of this effort. If I said it was COVID, they drop everything, right? But if I say it's suicide prevention, you have to fight to get everything. So I'd like to see other cities in California and maybe beyond do something like this. So that's sort of a quick overview of what's going on in this county. So as I mentioned, what we're going to do now is we're going to go through each of the panelists. I told them they each have something like 7 or 10 minutes. And hopefully we're all done quickly enough that we leave you time for any questions. And if we don't, I'll stick around and answer your questions. So Senator Cortese was very helpful in writing to several of the city councils. He wrote a beautiful letter that said you need to support this policy, pre it going to a hearing. And he's been very helpful. But I also know Dave from before that because he was on the Board of Supervisors that approved that county plan that we're talking about. And he wrote about it in some of the correspondence he sent out to different cities. And so he's been instrumental in supporting this type of policy work. And I welcome you making some comments, Senator.
Well, thank you very much for inviting me. Thank you for having me here. And thank you, Vic, I might need to get behind the speakers. Thank you Vic, for your leadership. I can't even think of words really to describe the role that you've played in terms of keeping people together, convening people, keeping this top of mind as much as possible. And I really appreciate your remarks just now, and including the part of your remarks that really talk about, if it was COVID, people drop what they're doing. If it's this, not so much. Maybe there's reasons for that. I think there are. I don't think it's necessarily stigma alone or anything like that. I think that a lot of our systems are built around responding to victims of violence in whatever way we do that, with the penal code or by prevention and intervention in our schools and so forth, without really getting into the violence of self-infliction. And I understand suicide, especially when we look at it from a mental health lens and a sort of a clinical point of view, doesn't come in just one type or one modality, if you will. It could be so many different things. But if you just took the piece of it that is pretty significant, I believe, in this county, when you look at the coroner's numbers and you look at the number of deaths, the coroner reports that are self-infliction, and then you go over and you look at gun violence numbers and take a close look at them and see the number of gun violence deaths that everybody talks about, and Brady and everybody else out there that's trying to prevent gun violence, but they don't ever really parse it out in terms of what's really happening there. And we don't want any gun violence. I'll stipulate to that right now, but we shouldn't be sort of sweeping under the rug the fact that a majority of that gun violence in a lot of counties across the country and in California is suicide. It doesn't make the non-suicide any less important to do that, but I fear that because a lot of the organizations that lobby and focus in the gun violence area formed around a different type of gun violence than self-infliction. And if Brady formed around an assault, on elected officials, basically. The San Francisco, office mass murder that occurred years ago, got a whole other group together. And I don't blame them for having a focus. We should all have a focus. We have a focus today, right? It's different than that, but it's part of it. It should be part of it. If those groups that are getting national attention, that are really lobbying hard, getting governors like Gavin Newsom, in blue states at least, to come along and say, we're going to do 10 gun violence bills at a time, with mental health finally, becoming top of mind for legislators like it always should have been, maybe the national spokespersons for that kind of violent infliction on anyone, including self, can begin to include us, if you will, in that discussion, rather than us trying to spend the next 25 years ramping that up like you usually have to do from a grassroots level. Now back to the convening, and I know you wanted me to talk about that, and I'll pass the microphone over. It's so great that Supervisor Ellenberg was here, because county supervisors, for whatever reason, and the city officials, I think would acknowledge it at least in a subtle way, is county supervisors have always been able to convene. They don't have jurisdiction over the cities in really any meaningful area. Certainly the county participates. I think you and I were on the Cities Association together at one time. The county has a seat there with the 15 cities and the mayors. But there's just some psychology about it, I suppose, is when a Supervisor Ellenberg or a Semidian or anyone else says, look, we need all the mayors to get together because we're going to have an important conversation. It usually works. I mean, somebody usually shows up, the mayor or a designee. And so this was brilliant, I think, to organize. And I think your background, in some of the ways I just described, cities associations, so forth, probably played into it, this idea of we can convene our cities. Sure, they're a little balkanized. They have different economic development plans, and they have different strategies and different councils, different governance. But around this topic, like other topics that we deal with, we can convene them, and we can move forward together with action. Schools are another place that can be done. We saw that just now with SB 10, our fentanyl bill, which says, let's go into the schools and embed right into state statute, right into mandated safety plans, the requirement that you put plans together. I mean, on this specific topic, not just general, and if you look at the statute that created school safety plans, it's very much enumerated, right? It's A through Z, but none of A through Z had fentanyl in it. I have to go back and look what it says about suicide. If it's not there, right? Yeah. So, but the idea is, initially there was a little bit of, when we did that bill, hey, it's not our problem, or hey, why are you coming to us? So I can imagine sometimes cities, thinking the same thing when the county comes or when the state comes. But when there's an opportunity to weigh in and do something productive in an area like suicide or addiction or other behavioral health areas, from what I've seen, school districts, cities, even other agencies, and the state of California are all interested in working together. So, but it's important that the plans have teeth. And at some point, I think, the other brilliant thing about having the cities do these plans and getting everyone convened and everything is because there's then a mandate. I know you highlighted that real quickly with the slides, but there's some teeth behind it. It's not a suggestion. It's something that really has to be done. So, I started to say, I lost my train of thought there for a second. There was a little bit when we started that fentanyl bill, the school saying, well, wait a minute, are you saying that it's the problem's here, it's only our problem, or we're the cause of the problem? I know cities don't want to be viewed as a cause of the problem of suicide rates, whatever they are. No, what we're asking for is your collaboration and your cooperation, because you have tools available at your disposal. Cities do, schools do, captive audience, the ability to get to families, the ability to create information and awareness, the ability to mandate plans like you did here in this county that other people don't have. We can't get to these folks any other way aside from standing out here in front of the community center handing out flyers, and it's not effective. What's effective is when people have to be in a classroom, or people are already on a mailing list for community services, environmental services, garbage pickup, whatever it is, driving the message home to that captive audience and, to the cities. As I pass the mic, the cities that are here, I just say thank you for doing that, for saying no matter how big or small the problem is in our city, we realize that we're an excellent, excellent partner in this, and we're going to do our part.
Good, thank you. Let's see if I'm still on. Am I? Yeah. So, thank you. Yeah, thank you, State Senator. Next, we're going to have, as I mentioned, Councilmember Wally speak. Not only was she on the City Council that approved a city policy, in some ways they did it more readily than some of the other cities, but last year when she was the mayor of the city of Saratoga, at her initiation, she called me up and said, it's Suicide Prevention Month. We want to approve a resolution, I think it was. And she said, and I want to make sure that that's done. So give me some information, Vic, and I'll get it taken care of. And that's what she did. So she's a very active partner in what we're trying to do. So, and council member is going to speak a little bit about how you adopt a city policy.
Can you hear me? Okay, great. Good afternoon, everyone. Thank you so much for making the time to be here today. And it's truly an honor to be invited to talk to you in the presence of State Senator Cortese, who's done so much, incredible amount of work. And Wick, I have no words for what you continue to do. Your leadership in suicide prevention is simply exemplary. Your advocacy for those who need help, a voice for the unrepresented, saves many lives. So Wick mentioned that I'll talk about the process, the public policy process for a city. What does it take for a city council to adopt a policy? Victor was spearheading the efforts to have all the 15 cities in the Santa Clara County at that time to adopt the city suicide prevention policy. 2 years ago, during his efforts, he reached out to the city of Saratoga. At that time, 9 other cities already had such a policy in place. To get this item agendized, our city manager checked in with then Mayor Zhao and put it on the city council meeting agenda for discussion. This is the standard process by which you get things agendized to get council approval. And for the hearing discussion at the council meeting, thank you so much, Senator Dave Cortese. you wrote us a letter. And then we also got a letter from our Assembly member, Evan Lowe, both our state legislators for the tiny city of Saratoga. We are a population of about 30 to 32,000 only. Your letters to us recommending that we adopt a city suicide prevention policy. At the meeting, we were still on Zoom at that time, virtual meetings. Both you, Victor, and your colleague, Uday Kapoor, who followed you as NAMI board president for the county, National Alliance of Mental Illness, you both spoke at the city council meeting urging us to bring awareness to this issue in our city. You just said Saratoga was one of those cities that more readily adopted the policy. Well, I would say that is thanks to the efforts of our leaders, Senator Cortese, Victor Ojakian, Uday Kapoor. The city council in Saratoga unanimously supported the request. And at that meeting, we directed staff to come back with a policy for approval and adoption at a later date, because those are the steps we have to go through at a city level. At the policy approval level, Victor, I will say this, thanks to you leading the charge on this important issue, it is my honor to say that the city suicide prevention policy is the first policy I supported and signed as mayor of Saratoga in December of 2021. That's thanks to all the leadership by these leaders. Why is that significant to me personally? I was thinking yesterday, what can I share with all of you? And I started thinking, why is that significant to me? In public service, every day, we work on a very wide range of issues. Budget, roads, water, electricity, trees, you name it. But think about it. What could be more important than saving human lives? Nothing, right? Suicide impacts our community at all ages, genders, and ethnicities. It is the second leading cause of death between the ages of 10 and 34. 10th leading cause of death for adults in USA. Impacts of this tragedy are long-lasting on individuals and their families. What is heartbreaking is that this loss of life is preventable. So what's the value of having a suicide prevention policy? As Vic mentioned earlier, as elected officials, our duty is to ensure the health and well-being of our communities. Suicide prevention policy is a tool to bring awareness of suicide and to promote critical strategies for suicide prevention and intervention. This policy demonstrates that even in a small town, a small city like Saratoga, the city government can play a role in public health matters. We don't provide the services directly. We disseminate the information to people. As Vic said, that is key. We raise awareness, thereby destigmatizing the issue. As Senator Cortese said, stigma is a big challenge here. And we connect people with much needed resources. How do we do that? Through the Employee Assistance Program, employers can share information with and educate their employees on a routine basis. This is proactive, unlike what Vic was referring to earlier, that some city called after the loss, after the tragedy. During new hire orientations, it helps them to gain a better understanding of the varied causes of suicide and learn appropriate methods for identifying early warning signs and helping prevent loss of life. Every 4 to 6 months, staff is reminded about counseling programs. In the month of September, a page is dedicated to suicide prevention. Santa Clara County Behavioral Health Services, thank you, the county, and thank you, Senator Cortese, for your work going way back there at the county level. The County Behavioral Health Services has excellent resource materials on their suicide prevention website. 2 to 3 flyers from the county website are shared with staff and posted in break rooms. Small cities don't have the resources to do things themselves. We have a very limited budget, very limited staff. But working together collaboratively, we all are moving in the right direction. We touched upon this, so what were the follow-up actions? In September 2022, as mayor of Saratoga, it was important to me to proclaim the month of September as a suicide prevention month in Saratoga. I requested Vic and Uday, I spoke with both of them, and I requested them if they could attend the meeting so that the proclamation could be given to this cause as well as to NAMI. And also to give a public voice for them to speak. We were still meeting virtually, but I'm meeting Vic for the first time in person today. I've met Senator Cortese a few times. But it was a venue to give Vic and Uday to speak on this issue in a public forum in the city of Saratoga. That's what I could do as mayor. And it was my honor that they both agreed. So I urge anyone experiencing a mental health crisis to seek help immediately by calling 988, a 24/7 hotline set up by our county, the county of Santa Clara, or contacting the National Alliance on Mental Health Illness or other local resources for support. Thanks to the Santa Clara County Board of Supervisors, prior ones, current ones, for their continued support of mental health. The County Department of Behavioral Health for organizing this annual conference. Thank you, Mego. I think she stepped out. Thank you, Mego, and your team. Thank you, all the mental health professionals who are here and those who continue to work on this every day. Thank you, our state legislators. Senator Cortese, you have done a lot. Thank you so much. And last but not the least, thanks to each and every volunteer and community leader. We have one perfect example right in front of us, Vic. For your tireless efforts, you all make an impact every day. You save lives every day. You may not hear directly from the people whose lives you touch. You make a difference by honoring the sanctity of each precious human life. It takes all of us to collectively take proactive actions to look out for each other. We are one large family, as Senator alluded to earlier. That is true public service. Thank you all.
Thank you, Councilman. Thank you very much. So that doesn't leave last but not least, because as I mentioned before, Renee, who works for the city of Milpitas, was instrumental in getting their city policy passed, which they initiated. We didn't, in most cases, we went to cities and said, could you please adopt a policy? And then we went through the hard work of getting that done. But in Milpitas's case, they called us and said, would you come in? And Renee was the one who did all the real concrete work to get Milpitas's policy passed. But they also, as have a few other jurisdictions, not just taking their policy and said, okay, you know, if you have some materials, send it to us and we'll post it or whatever. They actually, like Project Safety Net, Mary Glonner sitting at the end over here, who originally was with a Project Safety Net, was a Palo Alto effort. Those cities actually did something. And so Renee's here to talk to us about Milpitas and the program that they have in the city of Milpitas. It's all yours.
Thank you. It is a pleasure to be here. I spoke at this conference, I guess, before a certain virus took over everyone's lives, and it was great to be there then, and it's great to be here now. I think we started our process in 2018. We've talked a little bit about how the community is so important, and actually that policy was started because we had a resident whose stepson had killed himself, or died by suicide, excuse me, and so he was left with questions. His wife had essentially gone into herself and left, and he just had a ton of questions: why and how, and why didn't we know, and why didn't we see it, which is a lot of the aftermath of losing someone that you love. So Vic was with us from the very beginning as well, and we wrote a policy that was akin to the other counties that were also starting the process, but knowing that I was probably going to be the one that was going to have to implement it, I wanted to make it something that you could do something with, and that gave the staff and the community the freedom to explore how it would work best. So getting ready for today, I actually brought the policy out, and I realized that I hadn't read the policy in a while because we were so busy with the work, and that made me feel good, because I don't know, in city government, often you have a shelf of policy that you could blow the dust off, and we wrote that really well, but we did it, but nothing necessarily came of it. And so I'll share with you a couple things from the policy. So the policy stated the Milpitas commitment to action to ensure that suicides are prevented, those living with mental illness receive support services, community-based care and close follow-up are available to people who attempt suicide, and resources and trainings are available to the broader Milpitas community in regard to suicide prevention and education. So I believe it was within 2 weeks of getting the policy approved, we immediately started sending out letters and asking for interest from our partners in the community and Santa Clara County if they wanted to be on the task force. That was faith-based partners. It was the school district, because they are an important partner for all cities and counties. We had Kaiser, one of the major healthcare. We had behavioral science. We had veterans, LGBTQA+ members. We wanted everybody there with us so that we could do this together, and we had all types of insight and all types of perspectives as we move forward with implementing the policy. And so what we started to do initially, as I turn my page, is set up the trainings. So think as a city who, our population right now is a little over 80,000. We're a mid-sized city now. We don't have endless funds like some of our neighbors, but we had some good access. And for a city, I think we are helpful with these community efforts because we can offer, we can organize, and we can help engage. And so the smaller nonprofits, the faith-based, the partners that we work with that need us the most, that is where we can help set up and help start movements through the cities. So we started with Safe Talks. We set up trainings and invited everybody, the county, the districts, the healthcare, pastors, anyone, nurses, everybody that wanted to come, they could come. We did assist trainings. We did Suicide Prevention 101. We made everything available to everybody to come out, learn how to recognize the signs of somebody who is feeling suicidal. How do you respond in that moment, and how do you get them the care that they needed? We had great participation. Everyone was willing to talk. Everyone was willing to learn. We set up trainings for teens and their parents. So they started together, and then there were breakout groups so the parents could learn separate from the teens. I have a teen. She doesn't want to learn anything with me, and that's fine. So it's better to have them in different rooms sometimes and then bring everyone back together at the same time. We just talked about it. It wasn't taboo. We had a couple suicides in our city after that. Relationships with our police officers became really important because we were doing this work together where we helped the families with crime scenes and care for the high school after there was a youth who had passed away. So it created and enforced those connections, which was also great. And then everyone was sent home. So what did we do during that time, which I think is important because it was also an important time for mental health crisis. We focused on social engagement and awareness. We created commercials that are up on milpitas.gov about people who had struggled but made it through and the resources that they used. When we were back out in the public and able to mingle in the open air together, we focused on time periods and events that already existed where we saw the highest rate of suicides in our city, Christmas and around April for Milpitas. And so we had tables at all of the holiday events. We had tables at our Pride event, at Brunch with the Bunny. We made it available. No event was off limits. It was there and we were there. And there were a lot of people that were helped who were moved by the material and who ended up talking with our social services coordinator after those events. So what are we doing today? There's a lot of work that's still being done. We ended up breaking our task force, which ended up getting quite large. People can come and go. So it was available to you if you wanted to participate. Meetings are hard, but we broke out into work groups and we identified areas of the community that we felt needed assistance, specialized outreach, and special care. And so we have a youth focus group, a veteran focus group, LGBTQA plus group, and a older adult or senior group, I think at this point. And from that, specialized information has gone out to those groups. We have people that are in those groups that specialize in that age group or in that culture or community. We have a brand new veteran support group that meets monthly. We work with the VA. One of the task force members is a veteran, so it's a passion of theirs. So it's really, there is no end to it. It just keeps going, and as new data comes in, new situations arise, new resources become available, we just pivot, kind of operate in the gray and go with it, respond to incidences, and when something happens in the community, you talk about it and you learn from it, and staff are trained, especially in like media training is huge. How do you talk about it in the schools? So we've trained with the school district on that because they have had a suicide or two in the last couple of years. And you just continue to learn, continue to work, and be open and available to everyone who needs the help and everyone that wants to help. I think that's it.
Great. Thank you, Renee. And So I'll say a funny thing right now. So listen through the whole sentence because you say, why is he saying that? The first part of what I'm going to say is, we all live in cities. And that seemed like a funny thing to say, but what it means is, if you live in a city in Santa Clara County, they have a city suicide prevention policy. And it also means if you're around some of your city council members or local government administrators, let them know that they have a policy. And it doesn't hurt to say, is there something that you think you can, you have a policy, is there something you can do to implement your policy? So a little more, hold your ears, Tina. Is there a little more you could do maybe? I heard Milpitas is doing just a whole list and litany of things. I mean, it's your community, and if you want it to be safe, it's all of our responsibilities to try and let cities know, that we appreciate what they're doing, and we hope they can do some other things to make everybody safe. So we're going to get to you, Mary, in a second. So we still got a little more than 10 minutes, so we're going to take questions. And Mary, you've got the first one, it looks like. So I think that's a really good comment, Mary. And right now, I think what we're doing is looking at programs like Milpitas's and yours as, frankly, you're almost pilots for us. In the case of all the city policies we got a contact name for each of the cities. That's who we've been sending some, they all got a notice for this conference. And that's probably as a next step. How do you gradually build it up and bring people together and also share what everybody's doing and learn from each other? So it's a really good comment. Yeah, Tina.
So thank you, Mary. I don't know which city you're from, but earlier when I forget either the senator or Wick mentioned the cities association. I think both of you mentioned because you were at one point together. Yes. So thank you for that service of yours, and that cities association continues today. It's all the 15 cities of the Santa Clara County. We send one elected official city council member and one alternate to attend. There's a board of directors that meets, and we have monthly meetings. We get together. Wherever the president's city is. Last year was Los Altos, this year Margaret, so Mountain View. And we are actually in the process of trying to form a JPA, literally as we speak. Yes, thank you. Thank you, Senator. All your experience, you remind me what's crucial information. So it is a public meeting, Cities Association of Santa Clara County. It's a Brown Act body. And I have been there, this is my second year. 2 years ago, I was an alternate, so I attended some meetings. Last year, I was there, all the meetings. And this year, I'm there on the board. I'm also on their executive board right now. So one of the initiatives this year that we have tried to focus on different aspects, and one of those is mental health awareness. We have not gotten to it because we meet only once a month, but this is a forum for one council member from each city to come together. The awareness part is very high. Sometimes we are not able to succeed in achieving everything because there's a lot we are doing in our own cities. I mentioned limited resources in each city, right? The council members in most cities in the Santa Clara County, we are volunteers, we don't get paid. We are putting in a lot of time and effort, but mental health is an important issue. I know it because a lot of my colleagues from different cities, we talked about it. So that is one forum where even awareness, listening to each other, we take that back. And I connected with the remark made earlier by both the supervisor and Wick, that we are directly in touch with the communities. Somebody was asking me a few days ago, so what's happening this week? And I mentioned, oh, I have to speak in a few places. Today I'm here as a panelist on suicide prevention. Boom, there is an antenna right there, people in Saratoga. Some of them know it. I'm going to the library a few days later. So maybe I'll refer again once I am there. This is what I am. I'm talking to Cub Scouts and their parents next week. So this is how the awareness by word of mouth, the information, how it spreads, and the destigmatization, a key point that the senator talked about earlier, happens. Thanks. Sorry, I took a little longer, but I wanted to
That's
bring
okay.
up the cities association
I
remark.
will say this too, since now you're educating people on some of the other entities in this county they might not be aware of. The county passed the suicide prevention strategic plan, I think it was June of 2010. Then Supervisor Cortese was one of the people who approved it. In September of 2010, we took that plan to the Santa Clara County Cities Association. And one of their members, after we gave a presentation, stood up and said, I'd like to make a motion to have us formally approve this plan. So all 15 cities sitting there at that time as an entity, the Cities Association, passed a motion to endorse the county plan. So we've done things through them before, and your suggestions together is a good one. Now, we still have a few minutes. Question. Okay, Jen, yeah, I can give you mine. Yep.
Thank you. I'll sit back down. Hi, everyone. Thank you so much, elected officials. And my name is Sylvia Tang. I use she, her pronouns. I'm from San Mateo County. And I really appreciate Santa Clara County and all 15 cities for paving the way for other counties like us. This is something I'm really hoping we can do in San Mateo County. And I have 3 questions, so I'm just going to say them. And if you don't have time, I understand. So we have, I've been in touch with our mayors. We have 20 cities, and they started last year, I believe, a mayor's mental health initiative. And so I've told them about the great work that you all are doing, and Vic's been so great to send me templates, so it makes it easy to try to implement it in our county. A feedback I've gotten is, I think a lot of the cities want the county to first create a template and first adopt a policy like the cities have adopted, and then the cities will follow. So I have 3, yeah, I have 2 more questions after that, but I'll stop there.
Remember, your county adopted a suicide prevention plan because I work with them on that. So they in essence, the county has a policy, which is an overriding strategic plan to work on suicide prevention. So the cities have what they need, in my opinion.
Appreciate that. And a couple more questions. One is, I've also gotten feedback on counter argument, like why should we focus on a suicide prevention policy? Why not make a mental health policy? So I'd love to hear your thoughts on that.
I'd be happy if they did both. So I didn't mention, and I don't know if it was worth mentioning, some people said, oh, there was a hiatus in your getting the city plans because a few cities, unfortunately, like Palo Alto, as Mary Glonner can tell you, started working on this because we had so many teen suicide deaths. And then some other cities, without explaining, wanted to put a policy in place because frankly they had tragedies in their own city, including in one city a staff member who was very popular took his life, and people were very upset about that. And then we took a break. The reason why we took a break is we got all the school districts to adopt a policy, a student suicide prevention policy. And after some other work, without explaining this all, the state has a state law, pre-Senator Cortese, though I think we can find things for him to probably propose. The state, passed a law, so all the school districts in California have a student suicide prevention policy, and they pretty much do because somebody did a survey without explaining, And we know that a small percentage hadn't adopted, which means a large percentage had. So I guess the point is, you can adopt. One of the things we're working on in a statewide committee, not in Santa Clara, is the adoption of a school district mental health policy. Some districts have already done that. They're in Southern California. They're not necessarily here. But I don't think it's an either or. I'd be happy to see both. I always consider suicide prevention, though I know people will argue about this in some different ways, Sylvia. I always see it as a subset of mental health. Not all people with a mental health condition necessarily have ideation or plan or intentions or attempt to take their life. But a good percentage of people who do take their lives have a mental health condition. I mean, there's a little bit of a debate about that, but to me, the key to suicide prevention is working with those people who have a mental health condition. So I think the city, or if they choose to adopt a mental health policy, tell them to put a subclause in it about suicide prevention.
Appreciate the response. I have one last question.
Yep.
So I appreciate there was a slide about the social ecological model and how we're thinking about health and how a lot of our health is affected by what the cities are governing and different aspects, housing, minimum wage. And I've been in touch with Humboldt County, and we've been starting conversations around, I don't know if any of you heard of this concept called health in all policies. And so I'm wondering how this can connect to that, because maybe when we look at our housing policy or other policies you look at, maybe we can think about health, mental health, suicide prevention. Just curious on your thoughts on that.
I'll let the elected people talk about it. I already did my
Thank
service.
you.
Yeah, thank you. I don't know all the ins and outs of the health and all policy, initiative or program, but we've got work to do beyond the schools and the cities themselves, although it's really, really good to have those government entities be early adopters. For example, we have 7th and 8th graders here that are doing peer referral into wellness centers right here in Santa Clara County, yet we have adult, centric employers who are saying, how do you do that? We don't know how to do that, so good that we have schools, moving ahead, and good that we have cities saying we're in. But we introduced a bill this year that's on the governor's desk now called SB 553, which is to prevent workplace violence. But a key provision of that bill had to be taken out, or we would have never got it to the governor's desk. And it's, correct me if I'm wrong, Tarsh and Krishnan's here if I misstate this, but the bill required originally in each employer's plan. Employers already have an illness and injury prevention plan. It doesn't speak to violence at all. And we said it should have, that plan should guarantee, should document what their wellness referral system is. It doesn't mean they have to have a wellness center there like our middle schools do, or high schools in some cases. It just simply says you have to have a wellness referral, available, right? And there's been obviously some legislation that's gone in that direction, but employers at the largest corporate level, especially retailers, I don't know why exactly, came out and said, oh no, oh my God, how are we going to do that? Well, how hard is it really? I mean, we have one for the Senate. I mean, everybody has, a thing to put on front of your desk that says, whatever is happening around you in your environment, if it seems like a mental health episode or crisis or whatever, this is the number right here. And it's connected to our own HR and so forth. So what I'm trying to say is, and I'll conclude here, I think, and I'm wondering if cities can help with this. I know the counties can because they have pretty strong public health jurisdiction. It can go in and write ordinances that require things like that locally, county by county by county. I'm wondering if cities may be able to do that as well. I don't know, but it seems like there's a nexus. when you're issuing permits, building permits and so forth, right? Why not have city attorneys start exploring when we issue that permit, can we require as part of the working conditions in that place that there be a mental, obviously it would include mental health, but a mental health wellness referral system, and make them say before they pull their permit what that is. Fill it out. They have to, show that. And that way, code enforcement, we don't just have to depend on Cal OSHA, code enforcement, if they're out there inspecting that facility for some reason, somebody reports too many banana peels on the floor and somebody's going to slip, they can say, by the way, can we see your health or mental health referral plan, and make sure that in the ordinance that it's updated once a year. It's not just something you put away in a file cabinet. It's updated, it's shared with workers. Everyone's either in a school or at a workplace, or they're retired from a workplace, in short. I mean, these are all places where we have captive audience, co-worker mental health issues. We did this because of the BTA shooting. Co-worker, and you saw what happened at Half Moon Bay. Co-worker mental health issues are a big thing. And people who are working with co-workers oftentimes afterwards say, well, yeah, we heard this, we heard that, we saw signs, we saw indications, just like classmates will say that in those situations, but we didn't know what to do.
Okay, I'm going to wrap this up because we've gone over by a few minutes. If people want to ask me questions, I'll stand outside for a few minutes. I have to wrap up because another session, not only is another session going to be in here, but my wife's leading that session. And you don't want to get me in that much trouble, I hope. So anybody else who has, I can see maybe some of you have some other questions. I'd be happy to stand outside here and you can ask those. I want to thank Renee, Tina, and Dave for their time and their wisdom. Thank you. And thank all of you for coming.